Am I having a stroke? Let's talk about it. Super important. Strokes are time-sensitive problems. You've got about 90 minutes to get them figured out and fixed, and you can have a large reversal rate if you can get them treated within that 90-minute window. Typical acronym for people having a stroke is FAST, FAST. So facial weakness, arm weakness, facial droop, arm weakness, speech problems like me, and it's time to get to the ER is the T. I just had a patient just a couple days ago. He called me, he actually texted me, he said, something happened. I was driving along and I had a sudden onset of a severe head pain, and I barely kept consciousness. Now I have blurred vision in one eye. I can barely see out of my left eye, and I have no other symptoms. He says, I feel okay otherwise. I have a headache still, and I can't see out of my left eye. So that doesn't follow that FAST acronym. So he texted me and he says, I don't know what's going on. I gave him a call immediately. I said, tell me some more about this story. He gave me the whole story, and I said, listen, it's time for you to get to the ER. You're having a stroke. At first he didn't believe me because it doesn't, I don't have left arm weakness, I don't have any slurred speech, I don't have any other problems, what's going on? And I said, no, this is a different area of your brain that can also be a stroke. And so that's why I wanted to do this video, just to bring awareness about different types of strokes can be very different than classic left-sided weakness or paralysis, droopy face, slurred speech. They can be very, very different. And so this one was one of those different ones. And his was just left eye completely gone, and a headache and a little bit of blurred vision. So I told him, listen, it's time to go. He's like, I think I'm okay. I said, no, it's time to go. And finally I convinced him. He went immediately to the ER. On his way to the ER, I called the emergency room doctor, let him know. I said, listen, I've got a guy, he's on his way there. He doesn't want to take the EMS, and so I'm calling you to give you a heads up. Get your stroke team ready. They got their stroke team ready. We got him treated within 30 minutes of onset of his symptoms. Fantastic. He got a CT scan, they ruled out a bleed, and then they went right away into a clot buster treatment with TPA. Two types of strokes. There's a hemorrhagic stroke, which is a bleed, and then there's an ischemic stroke. A large percentage of strokes are ischemic, which means a little blockage. It can be a blood clot, it can be a plaque, like a atherosclerotic plaque, like cholesterol plaque that goes and clogs a vessel as well. Super common and super important to bring awareness. A couple of years ago, my mom was working and she had a complete catastrophic stroke. Her left side was completely done. She couldn't see straight. She was vomiting. She had a massive headache. And she didn't believe she was having a stroke either, and she's an RN. So when you're in the thick of these situations, it becomes difficult for you to navigate, am I having a stroke or not? I had another patient just about a year ago who he just couldn't work his phone. He's like, I cannot work my phone. I've got a little headache, my blood pressure's a little high, and I'm confused about my phone. I actually went out and evaluated him, and he had a couple of other neurologic deficits as well. But again, it didn't fit that FAST criteria. He didn't have a facial droop, he didn't have arm weakness, his speech wasn't slurred, he just couldn't work his phone. And so there are some atypical areas of a stroke that can happen. His was actually a pretty big stroke. We got him treated as well. At Voyage Direct Primary Care, I'm Dr. Sanders. I'm a board-certified family doc, and we offer a comprehensive family medical subscription service, and we're available and accessible. So that patient that thought he was having a stroke, he just reached out to me really quickly and easily. I was able to just really easily tell him he was definitely having a stroke and get him the care he needed. Just one of the ways that we're fixing a broken healthcare system. And you can check us out on our website, voyagedpc.com. I hope you like this video. For more content, make sure you like our Facebook page, subscribe to our YouTube channel. We'll have more exciting content coming out pretty consistently.